actually started out as a medical doctor. I went to med school and I was going to be a medical doctor, like a family doctor or emergency doctor. And this was back in 2015. I started really learning about AI and just diving into the interesting world of machine learning and AI. And I got um, so inspired by what the technology could do in healthcare, specifically for patient care and for us actually better understanding like how hospitals work, how hospitals operate, how we help patients, that I ended up not doing medical practice and building a healthcare startup after med school. So this was in 2019.
Mhm.
And my vision with that was to start to use machine learning and AI to help us analyze our clinical data for hospitals. So a lot of hospitals had lots and lots of data that they would not know how to best use for patient care, and the doctors would get very overwhelmed by how much information there was. And so AI for me was a way for us to make better sense of this information and to ultimately help people make better decisions in hospitals, uh, understand the data, and then customize the patient care to the experience at the end of the day. So I did that startup for 4 or 5 years, and it was very successful. And we worked with a lot of hospitals all over North America. We built out a large team, and I never ended up going back to medical practice, and I just focused on really just AI. And in the last 2 years, um, I've been kind of in a transition phase where I've been really thinking about what can we do, specifically me as a doctor that's been trained to help and heal people, but also as somebody that's more technical that understands AI and understands how it works and where it might evolve. What can I do to help the most amount of people with this technology and with my experience? And that's what I'm passionate about now.